I come from a place that is near the lake. So you will find that a parent is advising the child that, Aoko, go there near the lake, get us fish. Specifically, they will say, wendi kutuletea samaki, because they know that if a girl, if you go there, then you'll find somebody, some prospect, somebody who wants you a suitor, and then he or she might give you, let's say, if there's a fish for, one fish goes for 200 bob, you'll find that this guy will give you 3 fish because he has other agenda. So that continues, and then you find that if you get pregnant, they'll either marry you off to this man or they marry you off to another person.
Looking at issues around sexual reproductive health rights, or as people, we like to cut it in short as SRHR, this is an interesting place or interesting topic to talk about, honestly.
One main thing that sadly happens is wife inheritance, locally known as TIR. So wife inheritance is upon the demise of your husband, the community members scout for someone fit to take over. And they normally term this as a cleansing ritual because they believe that the death of your husband is a sign of bad omen. So what this does is that because it's normally forced, so then that means there is no use of protection. So this then propagates the spread and transfer of HIV, and one inheritor, wife inheritor, can inherit like the whole community.
Issues around fish for sex has been a problem for a while now. We've tried to fix it. We've tried to ensure that we talk to young people, trying to give economic empowerment and all of that. But still, there are few people who are still having those retrogressive stories or retrogressive imagination.
I come from a place that is near the lake. So you will find that a parent is advising the child that, Aoko, go there near the lake, get us fish. Specifically, they will say, wendi kutuletea samaki, because they know that if a girl, if you go there, then you'll find somebody, some prospect, somebody who wants you a suitor, and then he or she might give you, let's say, if there's a fish for, one fish goes for 200 bob, you'll find that this guy will give you 3 fish because he has other agenda. So that continues, and then you find that if you get pregnant, they'll either marry you off to this man or they marry you off to another person.
Culture is a very interesting aspect when it comes to advocacy, because it has been their culture to do so. It has been their culture to send your daughter to go and marry or to go and have sex with a certain person, for you to be given 2 fish or 1 basket of fish for you to sell, to start a business. You know, it has been the culture of, in Luos they say, nyako in muando, like a girl is wealth, you know, because they will be exchanged with a lot of, with something at the end of the day.
Another issue is sex for gold. So again, we have a gender disparity in economic dependence and economic ability. So women sell their bodies to get gold as a source of livelihood, which also gives rises to issues like sexually transmitted illnesses, including HIV, increasing mortality rates, and also making the economic system to be very weak because our main labor force, the young people, are dying.
Majority of teen girls get pregnant. There was a time before Corona or after Corona, I can't remember clearly, but we had more than 10 school-going children pregnant. And they were young girls, barely 20. And you find that the moment they get pregnant, they are either getting married or going to work for someone else as a maid, and their education stops.
And in this case, in most cases, these people are always people who have like 2, 3, 4 wives already. This means that if this person has just been having random sex with people to bring food to the table or on the table, you realize that they are infecting these children with STDs, STIs, pregnancies, HIV, and many other sexually transmitted infections or diseases. And because these are remote areas, these children have no idea. I'm saying children because they are as young as 12 years old. These children have no idea of what is going on in their bodies at that particular time.
There are also other myths like the persons with disabilities are not marriageable, and for this reason they cannot even get into intimate relations or sexual relationships. This is basically a myth because it has not been proven in any space. So this is just used to kind of discriminate. It's a deliberate discrimination kind of a statement to kind of weigh them down so that they don't become proactive in accessing sexual and reproductive health issues, sexual and reproductive health information, and issues of sexuality and so on and so forth.
And we can never ever separate sexual reproductive health and sexual and gender-based violence. We can never separate. These two has to go together.
Issues of gender-based violence, gender and sex-based violence, persons with disabilities also face the same. Yeah, and because they feel that they are very vulnerable and nobody would want to listen to them, they kind of suffer in silence without reporting such cases, because even if they report, the likelihood of somebody in authority or a law enforcement agency taking them very seriously to support in addressing these issues are very minimal. And level of understanding, because the context, the person will understand from the context of a person with disability, and they may not want to relate with the real life scenario and take it as a human rights issue rather than segregate it to a disability perspective.
For the LGBTIQ community, the commodities that the queer community uses are different from what the rest of the world uses. I'm saying the rest of the world, but it's different.
So this means that there should also be a policy in place that kind of guides the health service providers to ensure that there's a trained health service officers or providers who can interpret on sign language interpretation, or who are knowledgeable on sign language interpretation, so that issues of sexual and reproductive health facing youth or women with hearing impairment can remain confidential between the doctor or the medical service provider and the person who is affected.
The role of government is now legislation to outlaw and criminalize forced any activity that is done not for medicinal purposes. So any infringement of the sexual rights of a woman. It is the duty of all legislatures, all CSOs to formulate policies. For example, the one that you're currently in the process of tabling it to the SRHR County Assembly, the SRHR Widows Protection Bill, so that each and every woman lives a dignified life, enjoying all their rights and to achieve their full potential.